Good evening, friends and family, and thank you for coming to another night with Repair, Restore, and Grow Black Communities Behind Black Business. And we have another special guest for you tonight, Dr. Constance Shabazz. And Dr. Shabazz, I want to thank you again for taking time out of your busy schedule to be with us tonight. Thank you so much.
And thank you for having me on this evening.
Absolutely. And Dr. Shabazz is the founder of Salaam Community Wellness Center, which is located at 611 East 67th Street. And we're going to be talking about health tonight. But before we get started, as you know, we're a nonprofit organization and we've been working to circulate the dollars in our communities by supporting our Black owned businesses. And that's why we bring these podcasts to you. And this is another wonderful business that we should be supporting because of how important it is in our community. And we also are great supporters of our bookstores. And Dr. Shabazz and I were just having a conversation about our bookstores. And we used to have 22 bookstores here in Chicago. It dwindled down, but there's some people that have been really holding in there. And there's also a resurgence of new books. It's important that we read. That's where our knowledge is. That's how we get on the same page because we understand the history, we understand what's going on now and what could possibly happen in the future. So reading is very important. And as you know, we feature a bookstore on our website every month. And last month it was Burst into Books in Roseland. And our book of the month was Rest is Resistance by Tricia Hersey. And this is a book. It addresses a pushback against capitalism and white supremacy as a way to connect the liberating power of naps, daydreaming, and rest as a foundation for healing and justice. And Tawana Johnson, you are the winner of our book of the month. So we will be giving you a call. If you can, we would like for you to go to Burst into Books to pick up the book. But if not, as we promised, we will ship it to you. So congratulations to you, Tawana. We ask that you read the book and you share the knowledge and you support our bookstores. And so for this month, Frontline Bookstore is our bookstore of the month. And they are operating online, and their website is D as in David, I frontline.com. They have a beautiful website of some very heavy books. Brother Say Cool has been out here for a long time promoting a lot of information. And the book that he chose for this month is My Life and, and Ethiopia's Progress, the autobiography of Emperor Haile Selassie. So if you want to win a copy of that book, all you have to do is go to rrgbc.org and subscribe. That's it. And we also want you to know we continue to support the Southside Community Federal Credit Union that is located at 55th and Wentworth. They have many products for you in terms of personal loans, micro business loans, car loans, financial literacy classes. Matter of fact, this past Saturday, they had a class for businesses. There was a Zoom meeting, and I participated in it, and it was a wonderful discussion. So banks are here to help us with our financing. And in order for the bank to survive, they need us to open up accounts. So we ask that you open up an account at the Southside Community Federal Credit Union and look at taking advantage of some of the products that they have. They've been in our community for over 20 years, servicing people who can't go to some of these major banks to get loans and to get the support. You can put your money in there and you can let your money sit there, but what is going to be the reciprocal um, uh, benefit of doing that? So please support the Southside Community Federal Credit Union. And I do want to back up with the bookstores. We still have asking you to go to Save Black Bookstores Chicago at change.org and sign our petition to get contracts for our bookstores. We want our schools and we want our local libraries to give contracts to our bookstores. This would help them so much. And as I've said, this is not something that is unheard of. It happens in other municipalities. And it would really give them the resources that they need to really put information out here. So please go to Save Black Bookstores and sign that petition. All right, so let's get started. Um, Dr. Constance Shabazz, I read your bio, and I do want our audience to know that they're listening to someone who has had a lot of experience and is highly credentialed and recognized. Um, you have your medical degree from Southern Illinois and at the School of Medicine. She has a master's in business administration and public health. Um, she was selected for the Public Service Fellow, John F. Kennedy School of Government at Harvard University. She has a master's in public administration. She served as adjunct faculty at the Graham School of Business in 19 let's see in May of 2021. She was distinguished alumni service award for the Southern Illinois University School of Medicine, and in December of 2024 she was also awarded outstanding community service award by the Theta Omega chapter of AKA, I would say, should I say Akarama? Absolutely, foundation. And her body of work has been over 50 years of service to the community, 50 years of experience as a medical physician in internal medicine, medical director, healthcare consultant, health center founder, dedicated to low income and marginalized communities. And her major focus has been on HIV, sickle cell, maternal health, child health, COVID 19, and addiction treatments. And what I like so much about this community wellness center is that it addresses or it has their position is integrative medicine and not just the traditional type of medicine where we're just you coming in and I got a headache and let me treat this headache, but they're addressing your whole body, dealing with your mind, your body, and your spirit. So this is a special clinic in our community. And the work that you have done and are continuing to do is special in our community. And I want to thank you, first of all, for the work that you have done and that you will continue to do, and for founding this clinic. So, as I told you earlier, I have some questions to ask, but I want to make sure that you get the message out that you want to get out tonight to our listeners. So, I'm going to let you start this with my one question is to what inspired the development of the Salaam Community Wellness Center?
Well, thank you again for this invitation. And I always like to talk about the origin story of Salaam Community Wellness Center. It actually started during the early days of the COVID-19 pandemic, which seems so far away from now with all the other things that are going on that are pandemics in this day. I was actually residing in Texas. I had run away from Chicago, and but when you're from a place, it's hard for you to disconnect from what's happening. And so what I saw in the early days was that in Chicago and certain communities on the South Side, that Black and Brown people were being disproportionately affected by
Mhm.
COVID-19. And in fact, in the South Shore area, there were the highest number of infections as well as deaths. in the entire state of Illinois, and the second highest number among nursing home residents. And even though my mother and my cousin were not alive at that time, they had once lived in the nursing home that had that statistic. So it really hit close to home to think that here I've been working in the healthcare field, working with marginalized community, low income communities, working with community health centers that are there and established to provide services regardless as to one's ability to pay, but yet we were still paying the price of not having adequate
Mhm.
health care. And so I began discussing with people, we were all doing things by phone or Zoom, and we brought up the idea or asked the question rather, what should we be able to do? What can we do? We have all this education, we have all these resources, but yet our people were dying. And so I have a godson who is a business person, and had opened up one of his businesses in the Woodlawn community, the block of 67th and between St.
Mhm.
Lawrence and Champaign, playing. And he said to me, "Well, I'm buying this building next door to one of my businesses, and you're talking about doing something about the healthcare in the community. This community has been without
Mhm.
adequate healthcare. I mean, it's diametrically opposed when it comes to wealth and access to healthcare. On one side of that community, as you know, is the world-renowned University of Chicago. On the other side, we have the projects, Parkway Gardens. We have the gangs. We have the drug abuse. We have the total opposite. And so he wanted to try to revitalize that area. And so one of the tenets that he was looking at as a part of that revitalization was healthcare. And of course, here we were faced with this pandemic. And so I was able to successfully organize a group of individuals like minded in terms of wanting to do something for the community around health. Many of these are people who are in the health field, the business people, educators, who wanted to come together and figure out how we can address the underlying conditions that put us, these communities, at
Mhm.
highest risk. But we did not want to start something, just
Right.
another health center, because Chicago has plenty of community health centers. I'm sure some of you all know some of Friend Family Health Access, um, uh, TCA, Aunt Martha's. But we wanted to make sure that we were not just opening up another health center, the one that really addressed the needs and concerns of individuals. And why is that they, despite these health centers, were not seeking medical care. It wasn't just the lack of
Mhm.
affordability, it was the way the model of healthcare is being offered to people. They were tired of going to a provider's office, a health center, and people were not even sitting down with them more than 10 minutes and really asking
Mhm.
what's wrong. Listening to not just the physical complaints or the mental complaints that they had, but actually many times people will seek out medical care because that is an entry point to try to get solutions or assistance with other things like their living conditions, trauma that they're experiencing, education, food insecurity. So we wanted one that is culturally appropriate, and we want one built on what I say is primary care, not the primary care where you just go to a practitioner's office and they take a history, a physical, do lab tests, order tests and
Sure.
prescriptions. We wanted something that really used primary care in the way it should be. And primary care is first of all, primary
Well,
listening
Dr.
to the patient.
Shabazz, can I
So
ask you
we
a
want
question here? That is a
sure.
major
Hmm.
complaint. When people go in to talk to the doctor. Who, why is that the case? Why are they only spending, 5 or 10 minutes with you? Who's who's behind all of that?
Well, that's the system. Back in the 60s and 70s, there was this current concern about the rising costs of care. And so that's where managed care came in. So what we're doing or what they're doing is managing the care. In other words, not necessarily, it's almost like they're
Mm-hmm.
rationing the care. So they limit the amount of time that you can spend with the patient. They base the productivity of the individual who's a provider, the number of patients they can see, but not necessarily the quality of
Mhm.
that visit. And so it's really driven by the corporatization
Mhm.
of healthcare. It is not driven by the science and the
Yeah.
practice of medicine. It's driven more how much money
Mhm.
can we make? And when we have these insurance companies that have gotten involved with this, and we know what happened back in, I think it was November, the unfortunate murder of executive of the United Health, that brought up a lot of issues that people were unaware of the way in which people were being insurance companies. They
Mhm.
had inordinate delays to get approval for tests or surgeries and things like that. And even recently, they talked about how therapy for autistic children was found to be very effective. And now the insurance companies are trying to figure out a way to deny it because people are asking for this therapy for their children. So it's the corporatization of healthcare. We do not have a healthcare system. And I know we say that all the time about, well, we have a healthcare system, but systems work together for a common good. And so this what we have is a bunch of corporations who are
Mhm.
working in competition, not in concert with each other. So back to your question, it's because the corporations have gotten involved, okay, and
Mhm.
they know because at least up until now that the government is willing to pay these corporations to manage the care, then they leave it up to the corporations to decide how the care is going to be provided. So that's why you have these limitations in terms of what the providers feel like they can do, because somebody's always looking at the clock and telling them how much time, which it may not be enough time for the, us to actually really sit down and talk to the patient. In fact, at our health center, we have an integrative model. And by integrative, we mean that we provide both Western as well as non-Western modalities. But one thing that we do not tell our providers is how much time they can see and sit with the patient.
Okay.
Why? Because it's the patient who is the focus of concern for us. And if
Mhm.
we don't take the time and let them be the driver of that experience, that encounter, as we call a patient visit, then we are missing out on the opportunity of helping them. We're not saying that we can be all things to all people, but that's why we try to work in concert with other organizations and other individuals to help things with social services, uh, job readiness, because that's a holistic model, the food
Mhm.
insecurity. But at least we are the ones who are, I would say, the gatekeepers, if you will, in a positive way, not to block people from getting services, but actually to help to facilitate them getting the services they need for a full holistic lifestyle.
And when you talk about people not wanting to come to the doctor, this kind of treatment, it doesn't create a level of trust in a patient with the doctor to feel that you're not listening to everything, you're not getting everything. And that's why I see people constantly changing doctors, and going to different doctors because you haven't developed this level of trust because they're not spending enough time with you to hear you out and to figure out everything that's going on. So I know during COVID, a lot of people didn't want to, was afraid to take the vaccines. That was another issue, right?
Oh, absolutely. But the history of the distrust in the healthcare, I could say, system is centuries old. Uh,
Mm-hmm.
they used to exhume our people's bodies to do scientific studies. They used to, of course, we've heard about Marion Sims, who was a gynecologist who is lauded for the development of the speculum, which women, this is a device used to be able to view the cervix. But he did it uh, experimenting on Black women who were enslaved and
Mm-hmm.
without using any anesthetic. And so we have a long history. And then more recently, Henrietta Lacks, this woman, had cancer, and they have taken her cell and made billions and billions of dollars off of it, and said legally, oh no, her heirs had no rights, for the protection of the use of her body tissues. Now, the family is trying to get restitution, and they are helping to pass legislation to protect others from having to be body robbed. So we have a long history, and of course, Tuskegee. And with Tuskegee, it wasn't what was done to us; it was what was denied to us. Okay, so that trust is, and these are not myths in our community. They've been passed on for generation and generation. But regardless as to what happened historically, just when you go into a provider's office, I cringe when I go to an office and the first thing they're asking me, not how am I doing, they're asking me, what insurance do I have? Am I going to pay my copay? I mean, okay, so I'm just some commodity, and as opposed to a human being, not even trying to find out what I'm there for in the first place. I'm not just there for you to be able to build and make money off of. Okay, so that's it's this cold and insensitive attitude that you feel like you're going through some kind of assembly line and not going to talk to someone who you think is going to be able to help you. The number one thing that any provider should provide you to make you feel as if to feel connected or trusted is that one, like I said, they're listening to you, they're spending the time with you. They should not be rushing you through. And even if they are constrained to time, it should be that you should still feel like, maybe they couldn't answer all my questions, but they may say at the end of an encounter, of a patient visit, okay, yes, I'm quite aware of these things that you're going through. Let's see how we can help you. Okay, that's the trust system. Okay, that's one that recognizes that we're all working towards the good of that individual. But what happens most time, you get handed off here. Go pay your bill there. Go get your prescription here. Go get this test done here. And you don't really feel as if anybody is looking out for you and making sure that you're getting all the things that you need. So that's why we also try to pull in other providers of services, mental health services. We have a program with the organization Entrepreneurs Academy, where they're teaching people how to grow their own food. In this day and time where all of these benefits are being cut, the SNAP benefits are being reduced. They took away and decreased the amount of money that people are getting for SNAP benefits when the hour or the stimulus money went away. And now they're talking about cutting it anymore. This was a number one reason for a way in which many children were able to be lifted out of poverty by having these kind of benefits to be able to supplant shortfalls in food access. So these are things that we are looking at and partnering with other organizations. And that's why I came up with the title for this about, talking about the dire U.S. system and community-based solutions. These are things that we still have the ability to do. We have this organic garden called the Paradise Garden, and this is our 4th year of growing fresh organic fruits and vegetables. And about 8 months ago, we started the installation of 2 of our hydroponic towers, which are located inside our building. And we are growing organic fruits and vegetables, and we're making sure that we are distributing free to people in our community. So these are the community-based things. But imagine, somebody is not just growing produce, but they're actually connecting with you. We go out in the community and we tell people about these things. They come to our garden. We have the opportunity to talk to them, not about here, just take this produce going out the door, but ways that we can teach them how to use the produce as medicine, food as medicine. Create a garden signs that have QR codes, and people can find out just using a little smartphone how they can use these fruits and vegetables as a way to be able to prevent and control many of these chronic diseases. That's what I'm talking about, community. And so that's the difference between what we're doing and what we're finding in many of these conventional healthcare systems. And we're looking at it, like I said, from a holistic perspective that every, and even the things that we offer, the deep breathing, meditation, music therapy, if people come to us and say, hey, I want yoga or massage, but yet they walk through the door, they get those services, that actually is an entry point for all the other services that are going to help to enrich, enhance their life, and promote their health and wellness.
And you know, Dr. Shabazz, as you was talking, I was thinking about the medications that people get saturated with. So many people are on medications. So many people are taking multiple medications. They take one medication and to deal with one thing, and it creates another problem, and then you have to take another medication to deal with that problem.
Mhm.
It's like, how much can your body take? You know, with all these different types of medications that you're taking,
Let
and the
me,
side effects. You know,
yes.
just the side effects.
Look, we've had a very robust conversation the past few days just about that. As my work, as I do my work as a clinical consultant for the federal government, I've visited over 300 health centers around the country. And one of my responsibilities is to review medical records. And invariably, I see that people are listed in their medical records as being on between 20, on an average, between 20 and 25 medications.
Mm-hmm.
Now, I know, and you know, if they were taking all of those, they would probably be dead. I see so much duplication and no notice or any inference that, not inference, but um, no signs that anyone has spent the time to do what we call medication reconciliation. In other words, matching up what that person is on with what they need. I had a personal experience with a family member where she went to a doctor for just a follow up. It was not her regular practitioner. And that person, rather than talking to the patient, looked at the medical records and saw that she was on, maybe about 3 or 4 different medicines that she has not been on in years, and actually put prescriptions in and sent them to the home. And this is a family member. They have some memory issues. Imagine if I was not there or someone else was not there to be able to ask the question or to question whether or not these medicines were recommended. She could have taken those medicines and had some serious side effects and death. So
Mm-hmm.
this is one area that I have really been pushing for, and I would like to have it incorporated in our program where people would come to us and bring their medications, and we would have a medical practitioner sit down with them and really determine what they really need to be on. And the
Mm-hmm.
second thing I see is there's this fear among medical practitioners to question somebody else's medical judgment. So
Mm-hmm.
they'll see a whole list of medications that the person is on. There's no ready way for them, to contact that provider or any of those providers. There may be 3 or 4 or 5 different providers to ask, why is this person on this medication? So what they do is they don't bother to determine whether or not that medication should be reduced or discontinued, just because of this fear that, well, I don't know why they're on this, so I wouldn't take it off because I don't know. It may cause some deleterious effect if we take them off of it. But really, what it's doing is adding to the confusion. And many times patients just stop taking it altogether, you know. So we need to have a system that is really about safety. I'm on medications myself, very
Mm-hmm.
limited, mostly vitamins and things, but I 1 or 2 prescription medications. And every month I get a robocall, telling me, oh, they're already sending the medication. And I might have plenty there. So
Mm-hmm.
we talk about fraud and abuse in the system, and we're talking about these cuts in Medicaid. They're not coming from the patients, they're coming from the system. In fact, there was a government report that said the fraud that is occurring is really occurring more from the insurance companies. You know what I'm
Mm-hmm.
saying? That they're doing fraudulent things. And I would just want to say this: United Healthcare was a poster boy or girl, kind of, when I'm talking about the gentleman who was murdered, I'm saying that they were a prime example. A lot of people didn't know until that unfortunate incident that they had a number of lawsuits. And one of the lawsuits was the fact that they were actually, after the providers were seeing patients and doing what we call medical coding, which aligns a certain reimbursement from the insurance companies for whatever the service was or the diagnosis that was treated. And when it went to the insurance companies, they had people at the insurance company, unbeknownst to the providers, who were actually adding additional codes or making that person's medical diagnosis or condition worse. And the reason why they were doing that, because these insurance companies, particularly for Medicare, are
Mhm.
intermediaries. In other words, CMS, which is a Center for Medicaid and Medicare, which is the federal Medicare program, they have outsourced to these different companies, the Blue Cross Blue Shield, Aetna, United, all of them, to do the paperwork. But
Mhm.
these institutions are paid by the government to do this, but they get paid more based on the severity of the disease that is being coded in there. And so what
Mhm.
they were doing, they were making the person's condition worse, and then they were getting paid. It wasn't getting back to the provider. The provider wasn't getting paid more. The providers often didn't even know that this was being done, and that's fraud. So we have these situations here where we got a system, again,
Mhm.
is allowed to do these things, and we don't get the benefit. The money goes to them, and we don't get the benefit. And
And
these are
the type of insurance that you have is definitely going to dictate uh, the level of care that you're going to get, or the type of care that you're going to get. As you mentioned, um, if you had cancer and you went to, you called a facility, or you called one of the cancer research or what have you, you're correct. The first thing they want to know is what kind of insurance do you have? And
absolutely
if you don't have the right insurance, the conversation ends. Um, and that's wrong, but if you don't, and that's probably another fear that people have, that they have to live with, that they don't have appropriate insurance.
right. And what we're facing right now is even worse. Uh, just to share with your listeners how these Medicaid cuts are going to affect us here in Illinois. And I know not everyone on your show or listening is from Illinois, but you can pretty much say that similar things are happening in their respective states. We have 1 in 16 individuals in Illinois between the ages of 19 and 64 who are on Medicaid. We have 1 in 2 children are covered under Medicaid. 2 out of 3 nursing home residents are on Medicaid. Many of the hospitals in low income communities are what we call safety net hospitals. So they have a disproportionate percentage of individuals who utilize the hospital services who are dependent upon Medicaid. We have all of these rural hospitals. We always think Chicago is a state by itself, but we got the
Mhm.
whole rural part of Illinois that's going to be affected by this. We're going to have closures of hospitals in our communities, and we have about 9 hospitals on the south side, and that's about half of what we had probably 30, 40 years ago, and with a growing population. So many of those hospitals are very dependent upon these Medicaid dollars. They already were strapped years ago with cuts in Medicaid reimbursement. And now they're talking about cutting it even more. We're talking about 257,000 people in Illinois alone who stand to be taken off the Medicaid roll. We already had people who did not re-enroll after the expansion during COVID-19, and that they because they didn't even know that they were taken off the rolls. Okay, so here, and then we have these draconian moves to put a work requirement when, say, maybe 60 or 70% of the people who receive Medicaid are already working. And think about
Mhm.
the people who are taking care of their disabled or elderly or infirm loved one at home, and they're not getting paid for that. They're still working. But here you're going to put these penalties on these people because they don't have a W 2 or 1099 to show. And then they add on to the requirement that they have to reapply. Imagine the number of people who, can't get out of the house, don't have transportation, forget
Mhm.
when they're supposed to re-enroll, who are not savvy in the computer,
Sure.
and all the glitches that go along with it. So we're in a really, really, really critical situation right now. But I'm gonna
Mhm.
go back to, that's why we need to be doing as much as we can to be
Right.
attentive to our health and using these other modalities. And when we talk about deep breathing, meditation, yoga, these are modalities that are used around the world. U.S. Well, the West, I should say, Western medicine is a new kid on the block. And I'm
Mhm.
not talking Western medicine, as you heard me say. We use the best of Western and non-Western medicine, but Western medicine has its limitations. It's
Mhm.
great at, acute treatments and, surgeries, things like that. But in the long run, we need that preventive care, okay, a more holistic approach in the way in which we uh, the healthcare that we use. It should be a model for everyday care, not just taking a pill. That's not a way to really be healthy. It mitigates some things. I'm not saying it to stop your medication if it's life threatening, but think about how many people who are diabetics, who, if we were not, if we were more attended to making sure as that there was equitable access to healthy foods in our community, and knowing how to prepare them in a healthy way, even in our schools. Some of the worst places to go to get a healthy meal, listen to this, is two of it, a school and a hospital.
That's right. And I've seen it. A school, a hospital, a nursing home.
Oh, please, yes.
And
Yeah,
in the schools, they might as well give the kids a bowl of sugar with a spoon for breakfast
exactly,
because it's
exactly,
all sugar. The food
exactly.
the food is terrible in the
Right.
schools, and then I've seen in the hospitals, even in the hospital restaurants, the cafeterias where the doctors are eating.
Right.
It's like where, where's the conversation? The conversation about the real nutrition doesn't happen until the person got almost 2 feet out of here, you know, when
Right.
they really will hit the whole nutritional aspect of it. And then there's the issue of stress. When you talk about, dealing with body, mind, spirit, and that stress creates a lot of illnesses
Absolutely.
that we end up with, you know.
Absolutely.
Uh,
Absolutely. We have the flight, flight and fight. Sorry, and that really is a endocrinological response. And that's good. We need to have that. We get the adrenaline to fight off something. But what happens with chronic inflammation is that your body is always working overworking, okay, and
mhm,
it really causes damage to our blood vessels, to our heart, to our other systems. And we need to know how to tone these things down. And there are a lot of inflammatory foods that we eat. Many of these additives in these processed foods trigger
mhm.
certain things, because I talked to some young men at a violence prevention program that we're working with, and they were giving them these chips. And I said, first of all, it was interesting because the little bag of chips that they had no ingredients on the back of it. And then I realized that this must have been a little small bag of chips. It was one of those, family size boxes. And
Mhm.
I said, isn't that interesting that they would not put the ingredients on the individual packets? Okay. So I was using it as an example. I said, okay, usually you're buying this as something as an individual bag. Tell me, when you buy this bag or open this bag or look on the bag, what is usually there? Is if it's chips, a potato chip, is it just potatoes and oil and salt? No, there are usually about 20 other items in there. Well, why do we need 20 other items there? I mean, hey, if you can make your own homemade potato chips and, all right, throw them in some oil, whatever.
Mhm.
So
Mhm.
what is that there for?
Right.
It's preservatives to increase the shelf life. The longer it's on the shelf, the more likely it's going to be bought eventually, and they're making money off of that. It is to alter the taste, to heighten the parts of your brain that say, "Oh, this is really good. I need to get more of that."
Mm-hmm.
It's a form of addiction. So we're trying to educate people about what they're eating and the impact it has on their body.
That's
Because if
right.
they're eating things that make them feel like they want more and more, that's no different than a drug addict, going out for more and more drugs
And
because you
even the visual effects of it, how it looks on the package, how it looks when you
absolutely
open it up. I was in line today at a store, and I looked across the aisle, and this lady had a bag of russet potato chips, and they looked very on the bag. It looked very dark, but it caught my attention. I was like, wow, I wonder how those taste. I was thinking that they would taste. They probably taste pretty good. But then what is it that was making that potato look so dark?
Hmm.
You
Hmm.
know,
Yeah,
what's in there, and you're consuming all of these additives. Your body is having to process all of these additives, and those put stressors on you outside of being black in America and having everyday stress.
right.
We
I like
get up in the morning and we walk out the door, and there are stressors that we have to deal with that other people don't. I was
absolutely.
telling someone about a young man who he was in high school, and he told me that he was going to go downtown for the first time that
Hmm.
weekend. He had never been downtown before.
A lot of people like that.
And so I asked him, I said, well, what was it like? When I saw him, when he came back to school, I said, what was it like? He said, everybody was so happy.
Hmm. Hmm.
That was his observation,
Hmm.
because that's not his experience when he gets up in the morning and when he turns on the television, listens to the radio, or walks out into the world. That's not his experience.
Absolutely.
And we're having to deal with those types of stressors
Mhm.
and all of this, you know, bad food that we're eating.
Absolutely. And if we are not eating the right food, it's as if we're walking out every day into a rainstorm without a raincoat. Think
Hmm.
about that. You
And
know,
then you take medications you got a headache. Take the headache. What's causing the headache?
exactly.
You take
Getting to the root of it.
medications to deal with the symptoms.
Absolutely. And then you read the bottle, it says, well, don't take too much of this. Gonna mess up your liver, mess up your kidney. So we really, you know, that's why it's so important for us to, like I said, not negate the benefit of
Hmm.
certain medications, because when you really look at some of the long lasting medications, and like aspirin and there's nitroglycerin is something that's been used for hundreds of years to helps the blood flow easier. It relaxes the muscles, to the heart. These are things that have been around for eons. Okay, so we're
Hmm.
not saying that there's not value, and they came out of natural things. When I say natural healing things, because people say, "Well, hey, this is natural." I said, "But poisons are natural." So we have to be careful. We want the right natural. Okay,
Okay.
so we have so much in our arsenal. And I'll give you an example. Yesterday, I was talking to some physicians, and one of them, both of them were, I think, from either Pakistan or India. And one guy said, "Oh, yeah, there's a certain fruit that has been found." Now, he's a physician now, has been found to lower blood sugar. But I'm looking at him like, are you prescribing it to your patients? You know what I'm saying? You know what I'm saying? They know that. I mean, he said, yes, I came from this culture, and we used to use this all the time. But yet, when they get here, you know what I'm saying? So this is
Hmm.
why, we really need to change this system and really push for not just the incorporation of all of these different modalities, but it's the mindset behind it. Okay, that we should return to the healing arts. Okay, which is it is the like the Chinese will say in traditional Chinese medicine. And I remember reading this in Bill Moyer's a book about a visit he made to China years ago, I think during I think it was the Reagan administration. And he was saying that the practitioners there don't get paid unless the patient
That's
is
right.
okay.
That's right. That's right.
So if that happened here, there will be a lot of either unemployed, a lot of practitioners who would
That's
be out of
right.
business. Okay.
That's
So if
right.
you begin with the end in mind, and if the beginning with the end in mind means that you should think, what is it that you're doing and what is the effect that you hope to have?
So here we're getting paid on you being sick.
Absolutely, it's a sick model. This is a disease model, and this came out of Europe. You know, when they discovered antibiotics, which we already did, we had Onesimus who came here enslaved, and Cotton Mather, his so-called master, was wondering what was this mark on his body. He said, "Well, that's how we were inoculated over in Africa against smallpox."
Hmm.
So that's why I argue with people. I said, don't think the vaccines are something that white people just think. I know, it comes from our roots, but it has to be done in the right way. Okay. But it's I think this is the time. I think that we're getting traction. I'm now in the process of talking with some of our healthcare systems and hospitals here about incorporating
Hmm.
this model. We're also working with Chicago Cred and those young men I've referenced earlier. We're coming in. We just did our first cycle of about 5 different modalities. I did an overview of integrative medicine, and then we had a clinical psychologist who was also a yoga instructor. Show them, talk about mental health, but also show them ways in which they can release anxiety. And these are young men who have either been perpetrators of violence, victims of violence, in most cases both. And so we're showing them ways in which they can modulate the anxiety. We also have a psychotherapist who went in and was talking to them, giving them some ways in which they could mitigate anger, anxiety, depression. Then the last session was with a music therapist who is a neurosurgeon, not neurosurgeon, I'm sorry, the neuro scientist at Northwestern, studying the impact, the positive impact of certain musical notes in terms of changing behavior. And so she went in last Thursday. I happened to be out of town and I was sitting in an airport in Ohio. And I said, let me check in to see how it went. And I opened up my phone and she said, she had already texted me and said, the experience was awesome. She said that these young men were on the floor on yoga mats. She did 20 minutes of what they call CDIM, which is clinically designed improvisational music. So this is not scripted music, but like I said, it's these musical notes that evoke certain areas in the brain, and they've been able to map it out. And these notes have been traced to parts of the brain that lit up that evoke the feelings of safety. Okay,
Sure.
she said that half of the young men fell asleep during the process. And the other half, she said, remained alert. She said when she did her debrief with them, which she always does, she gets feedback. She said that they were saying, we want more of this. We want to
Hmm.
be part of this study. And I've said that, music, as we well know, is a healer.
Sure.
It also music can be an inciter.
Yes.
Um, but if used properly, it is a healing. That's
Yes.
why we have it in the church and in other institutions.
Hmm.
But think of our people who were enslaved, who were brought over here in the bowels of those slave ships.
Yes,
What
ma'am.
were they doing down there?
Hmm.
What were they doing?
Singing.
Singing,
That's
humming,
right.
whatever it was that evokes the spirits, help me through this,
Hmm.
and that it was something that saved our life.
That's
So
right.
even there's a book that I bought when I went to Ghana a couple of years ago, and it was at the largest still existing slave castle, in Minor, And we went to the bookstore. And there's a little bitty book about, and it said, What the Slaves Did on the Slave Ship. And I'm like, what a title.
Mm.
Get to a part where they were talking about how they would allow the enslaved to come out on the deck. And so the women with the children, which, imagining having a child in a situation like that, they would be on the deck and the children would be allowed to play. And they would allow uh, them, meaning the enslaved, to actually use palm oil and to put the palm oil on their body. I said,
Mm-hmm.
that's massage.
Sure.
Okay. I said, so
Absolutely.
they knew what they were doing.
Mm-hmm.
Even though they really were not concerned about that as a human being, they're not doing it to make them feel better, but they were actually trying to protect their commodity, you know.
Mm-hmm.
And so, but still in all, they knew that that did something, that the soothing feeling of the hands and the oil that they were using, the coconut oil, all the fragrances in that. That's all part of
Sure.
that feeling,
Sure.
And so
Aromatherapy.
there you go. Thank you, sis.
Mm-hmm.
Thank you.
Mm-hmm.
So we can look at all of these different things that were part of our culture. And I'm just going to say another example. When the U.S. was formulating, maybe informally and formally, medical training institutions. Okay, there were very few so-called medical schools, but there were a lot of apprenticeships, where even the barbers were doing bloodletting and apprenticeships where somebody was training someone else. I mean, but there were so many different ways in which medicine was, or the healing arts were being practiced. Well, Carnegie, of the philanthropic claim and fame, he wanted to make some decisions about these institutions, whether or not he should be um, financially supporting them. So he got a guy who had no medical background. Name is Flexner was the last name, and this guy had evaluated educational institutions in Europe, but not medical institutions. But he knew something about the medical system, or how it was the disease model of medicine that was practiced in Europe. Carnegie commissioned him to evaluate all of these training institutions. Some of them were like more formal, some were like these apprentices. And at the end of that, he did this damning report called the Flexner Report. And this was back in 1910 that it was published. At that time, believe it or not, we had 7 African American medical schools.
Hmm.
His report was so damning because any of them that were not practicing that European
Mm-hmm.
model, he said that they were no good, that they need to conform to that European model. As a result of that, 5 of those 7 African American institutions were shut down, and many of these other institutions were shut down because they had no funding.
Hmm.
Does that sound like something that's happening
Yes,
today?
absolutely.
So we didn't get another African American. When we say African, we know we were not allowed to go just anybody's school. Okay, women weren't allowed, and certainly if we did get in these medical schools, it was a rarity.
Mm-hmm.
Okay, so we had no institutions other than the same 2. It was Howard and Meharry, I believe. Um, and so my question is, the point I'm trying to make is, well, how did we survive? If we were not allowed in the medical schools, we weren't taught. We were not allowed to access medical care. Oftentimes, like for example, in Mississippi is a good example. Black people had, if they had to be hospitalized, they had to pay before they could be hospitalized. Pay before, or if they were admitted, they were the last one who was attended to, last one who would get care. They would make the rounds on everybody else, but we were relegated to basements in hospitals. And the only thing that changed it was when places like Mississippi were told, in order for you to get Medicare money, which was in 1965, you had to integrate these hospitals. So how did we survive, sister? all this time. It was our roots,
Mm-hmm.
you know, mama, grandpa, and mom, grandma who found, who knew what was going to be
Mm-hmm.
healing our people.
That's right.
So
And they not
it is in
only
our
they not only had knew what to give you, but then you also got that attention. As you came out when
absolutely,
you were talking
absolutely
at the very beginning about people not getting enough attention, but you got that
right.
attention. Your grandmother or your great grandmother would be sitting by your bed, and
There
just
you go,
waking
sister.
up
That's
and opening your eyes and knowing that they're there was healing. Because as they say, the babies
absolutely,
who are not cared for and held, they can't thrive, you know, and that doesn't
absolutely,
go away as
absolutely.
we become adults.
Yes, I was thinking the same thing. Yeah, there were studies. They were comparing babies who in the neonatal nursery to those who they would have people come in and just surrogate
Okay,
moms and just sit there and hold them and
absolutely.
swaddle them. They found that their time in the NICU was decreased
That's
significantly.
right. That's right.
Okay, as it compared to those who did not get this. So it's the
That's right.
power, the power that God has already given to us. And so we got to get back to
Well,
that.
Dr.
That's
Shabazz,
that's all.
we have 3 more minutes. I did want you to speak to the fact that you also, I read something about work readiness, uh,
Yes,
as
workforce
part of
readiness.
your
Yes,
one of your services. You're offering all of these different services and interventions
yes.
that can really
Mhm.
help people. Can you speak to that?
Absolutely. Our mission includes economic empowerment.
Mhm.
And by that, we know that if we do not address what we call the social determinants of health, which include good education, safetiness in our environment, and good jobs,
Mhm.
housing. So we know that in order for us to be able to get people to pay attention to their physical and mental
Mhm.
health, we have to make sure that the basics of Maslow's hierarchy of food, clothing, and
Sure.
shelter. And so we've been successful to be able to partner with Entrepreneurs Academy and now other organizations to bring in and offer classes. Like right now, they're doing drone photography
Mhm.
classes. And these are classes, the drone photography is taken off in terms of business opportunities, as well as opportunities to get jobs, um, living wage jobs. We also have an organic gardening class, both the hydroponics, where you talk about that we grow things inside without the soil and just climate control. And we also have our outside paradise garden. And we're going to be adding more things. We're working with an Emmy Award winning chef. And for that it's the Chicago CRED program, the violence prevention program, we are proposing that we do a culinary arts
Mhm.
program, not just for the purpose of teaching them how to cook, and because we are in food deserts, and having healthy foods, sometimes you got to do it yourself. And it's also to educate them on how to create businesses, so all
Okay.
of this dovetails in there, that we want to make sure that we touch every aspect of health and
Absolutely.
wellness. And you know we're not trying to do it by ourselves, but I guess we are a magnet, we are a hub, we're an aggregator of resources that are in our community. And one last thing, we do that also through a program that we started last year, what we call the Health and Wellness Pop-Up. And we're bringing resource affairs to different areas of the community to make sure that everyone has access to what they need, be it housing, food, employment, healthcare, mental health.
We have been talking with Dr. Constance Shabazz, founder of Salaam Community Wellness Center, located at 611 East 67th Street. How can people get in touch with you, Dr. Shabazz?
Okay, and I just want to make a correction. The address is
Oh, it's
613
613.
East
Okay.
67th Street.
All
No
right.
problem. No. Our phone number is area code 773-435-9493. Our website is Salaam, SALAAMCWC.org. And we'd love for you to come out to our Integrative Health and Wellness Expo on August the 16th. It's free. And you can contact us at that number, as well as email. You can email me, C Shabazz, that's SHABAZZ, at Salaam, SALLAM, CWC.org. I know that's a lot. So hopefully, sister, you'll be able to share with them when they contact you.
Absolutely, absolutely. Well, thank you so much. Your work needs to be multiplied. You know, we need more uh, community centers like this. We need more medical facilities like this. Um,
And that's our
okay,
goal. That is really our goal,
absolutely,
sister. Thank you so much.
absolutely. Well, I want to thank you for coming on, friends and family. Please support the Community Wellness Center here with Dr. Shabazz. We ask that you support our bookstores. We ask that you support the Southside Community Federal Credit Union. You can also go to our website at rrgbc.org and make a donation to help support the work that we're doing here in terms of helping to circulate the dollars in our community by enhancing the awareness and support of the different businesses in our community. And this is just another wonderful business. Every week we have a wonderful business and some wonderful people doing some great work out here. And Dr. Shabazz, I want to thank you for coming on. And remember, support Black businesses. And thank you for coming, family.
Thank you so much
Yes,
again.
ma'am. Good night.
Good night.